Dr. Peter Jensen. I'm a cardiovascular surgeon by training, and I'm now a vein specialist. I practice in Salt Lake City, Utah. The practice's name is the Utah Vein Specialists. I grew up in this area and wanted to return to it. My background, after being educated in high school in Salt Lake City, I went to Harvard College, returned to Utah to go to the University of Utah Medical School. I was at Dartmouth, Stanford, and the University of Vermont for surgical training, and capped that off with a fellowship in cardiovascular surgery at Northwestern in Chicago. After 5 years of cardiac and vascular surgical practice, I began to specialize in vein care and have found it very rewarding both for myself and for my patients because of the rapid advancements of technology that make all of my work better and give better results to patients. My practice specializes in vein care. That always starts out with a careful initial evaluation consisting of a history and physical examination, and then most importantly an ultrasound, a very careful ultrasound examination to really define the anatomy of any individual's legs and to really define where their symptoms or problematic vein situations may be coming from. And based on that ultrasound, I, with the patient, will design a very careful care plan, and which usually extends into one of any number of ranges of therapies, including closure of the great saphenous vein using either laser or radio frequency energy. This is a procedure that has replaced vein stripping. It's ultrasound guided. It's typically performed with the patient awake, and I like to converse with them and know that they're comfortable during the procedure because it assures me that the vital structures of their legs are protected during the procedure. Other ancillary procedures or strategies that I might offer during that time would also include phlebectomy and foam injection of smaller veins. More problematic spider-like veins or telangiectasia can be treated with sclerotherapy and sometimes laser therapy to the skin. And those are typically performed after the catheter closures to assure that the water main, if you will, of the venous system has been appropriately dealt with before the more touch-up attention to the spider veins is performed. I really appreciate the opportunity to visit with you about myself and the range of my practice. If you had further questions for me, please don't hesitate to contact me or my staff at 801-501-VEIN. That's 801-501-8346. Or visit our website at www.veinsmatter.com.